It's a very, very difficult problem. The problem itself and the comparison between the two studies. The first study was a rather small, single, unicenter study, unfortunately without post-mortem data, indicating that cerebrovascular changes or subclinical cerebrovascular lesions may promote the progression of Parkinson's disease, of idiopathic Parkinson's disease. The second study was an overview of various clinical and post-mortem studies, also focusing on PDD, which we would not include here because a very recent study, the largest comparative study of PD and PDD from John Trojanovsky's group, said or indicated that cognitive impairment in Parkinson's disease is mainly related to the severity of cortical and limbic alpha-synuclein deposition. On the other hand, Thal's group from Ulm has shown that there is an inverse relationship between the severity of Lewy pathology, alpha-synuclein pathology, and cerebrovascular lesions. Now, in contrast to Alzheimer's disease, where we know that there is an impact of vascular pathology on the severity of mixed-type dementia and so on, there is still the debate on the role of vascular factors in the course of Parkinson's disease. Here we have a sort of prospective review, excuse me, showing the possible correlationship between Parkinson's disease and cerebrovascular disease risk factors, which is not my own. This had been shown in the National Review of Neurology last year. Now, what I would like to show you is a comparison of studies examining the prevalence of cerebrovascular lesions in patients with Parkinson's disease. There is one group with a lower prevalence since 1990 up to Gerald Benjamin and co-workers. They have shown either a lower incidence in Parkinson's disease, as in the second study, or no differences between cerebrovascular lesions and the severity of Parkinson's disease. We know that the incidence, the prevalence of CVS in patients with Parkinson's disease is very high. It ranges between 18 and 55%, depending on the basis of comorbidity, of the age of patients, and so on. Then there are many studies, both clinical and radiologic and pathologic studies, who have shown a higher prevalence of cerebrovascular lesions in patients with Parkinson's disease than in controls, higher prevalence of ischemic stroke, a higher hazard ratio for CVD than in controls and in Parkinson's disease, a higher prevalence of perivascular white matter lesions, and so on. And the same here, it was quoted already. We have done the second study in 2006 with 617 patients. We had a higher prevalence of cerebrovascular lesions in Parkinson patients than in controls. There were many studies who showed there is a higher incidence of white matter lesions, in particular on frontal white matter lesions. And there is a very recent study of the New Zealand brain bank by Guan and co-workers, a very small study, autopsy study on 10 PD patients and 6 controls. And they have shown that vascular degeneration in microvascular terms of course has been shown in Parkinson's disease much more than in controls. There were less capillaries, there were shorter lengths of capillaries, and there were an increase of the length of capillaries, as we show here. Here you have the number of small vessels, mainly in the basal ganglia, and here you have the ratio of the changes in the red nucleus, in the locus ceruleus and substantia nigra, which was very, very much more severe than in controls. So, I have to go back. And then here is a large table on the possible role of vascular factors in the course of Parkinson's disease. There's an older study, a Greek study in 167 patients that said that CVD may aggravate the severity of Parkinson's disease. Neuroimaging studies have shown a higher severity of white matter lesions in Parkinson's patients than the study by Professor Rector and co-workers. On the other hand, the study by the Tal group that Lewy pathology inversely correlates to the severity of cerebrovascular lesions, whereas microinfarcts were in both groups more prevalent than in controls. Antonini and co-workers showed recently neuroimaging study that multiple cerebrovascular lesions in the basal ganglia and the peravascular white matter may modify the presentation and progression in Parkinson's disease. Schwarz and co-workers in a clinical pathologic studies showed that there is a greater frontal white matter pallor and basal ganglia lacunes in controls than in Parkinson's disease. And the final study of Guan and co-workers from brain pathology 2013, a very small clinical pathology comparative study, 10 PT patients, 6 controls, that the vascular degeneration, less capillaries, shorter lengths, and damage to microvasculature were seen in Parkinson's disease patients versus controls, and this suggests that it may contribute to progression of Parkinson's disease. Now, in summary, I have to conclude we have no final decision on the impact of cerebrovascular pathology, in particular of small vessel disease, on the progression and on the outcome of Parkinson's disease, of idiopathic Parkinson's disease. Whereas we have to note that so-called lower body Parkinson's disease, vascular pseudoparkinsonism, is very rare, about 5%, and it differs in many respects from idiopathic Parkinson's disease, plus minus cerebrovascular lesions. Now, I think the question will be still open until we have more prospective studies, clinical pathologic studies on the impact of cerebrovascular pathology on the progression and outcome of Parkinson's disease. Thank you very much.